It's just going to be on my Facebook. Somehow I'll have to figure out how to put it on Doc Talk Live.
Oh, okay.
So that's frustrating, but you guys keep talking. Well, actually, let me introduce you guys. Yeah, I don't know how to get it on. Meeting is streaming live on Facebook. All right, we're live. Hello, welcome to Doc Talk Live.
Hey, how you doing?
I am on my homepage, but I am with Alex. You're going to have to help me with your last name, Alex.
Yes, it's Hajduczok.
Hajduczok. I'm with Alex Hajduczok, and I'm sitting with Rodney Oversteet. And welcome to Doc Talk Live. Typically, I do this on the Doc Talk Live page, but I think we're on my regular Facebook page. Rodney was good enough to do a Doc Talk with me last week on healing the healers, on helping healthcare providers seek help and deal with burnout.
Yeah, compassion fatigue.
Compassion fatigue, and then one of my fellows, Dr. Verma, was talking about this Whoop device, and then mentioned you, Alex, as doing a study, and the study involves this Whoop device as well as looking at whether or not we can actually, through physiologic monitoring, predict burnout. Is that accurate?
Yes, exactly.
Let's back up for me, like both you and Rodney were talking about the Whoop device. What is the Whoop device? And what are you drinking, by the way? Can I see that again?
Oh, it's Starbucks.
Oh, okay.
So the Whoop device is I have it right here. It's worn on the wrist. There's no watch face here, but it has the same photodiode sensor that an Apple Watch has, and it monitors your heart rate. And so it basically will capture every beat of your heart over the course of the day, and it can do a lot of different things with that. So one of the main things it does is it has an algorithm to determine your heart rate variability. And that's basically the biggest feature of the device. And what heart rate variability is, because it took me a while to even understand this, heart rate variability is essentially your beat-to-beat variation of your R-to-R interval, if you're thinking EKG, but essentially your beat-to-beat variation between heartbeats. And what that means is essentially how able your body is to respond to a stressor. So it's essentially the balance between your parasympathetic and sympathetic nervous system. So your fight or flight versus your rest and digest. And so, if you're sitting there and a tiger walks into the room, all of a sudden your heart rate jumps up as a response. And the rate that it jumps up, the rate of change there is going to determine your heart rate variability. Similarly, when you eat a big meal and your parasympathetics engage and it slows down your heart rate, how much it slows down is going to essentially determine your heart rate variability. And the way that's used is you have intrinsic and extrinsic factors that determine your heart rate variability kind of during the day. But actually, if you measure it at night during slow wave sleep, then it's a surrogate of how much stress your body is under.
Say that again. Say that last part again.
So essentially, if it's measured during sleep, where you have no extrinsic factors that are affecting it, that it essentially determines how well your body is able to adapt to this strain, and essentially how much stress that your body is currently under.
So when you're sleeping at night, when there's theoretically no stress, if you have a lot of psychological stress, you're going to have a more heart rate it's going to manifest itself by heart rate variability.
Correct. A lower heart rate variability would signify that you're under a greater amount of stress.
Why is that? What does that mean, a lower heart rate variability?
So it means that over time, your heart rate is not able to change as much to a stimulus, which would mean that your standard deviation of between your beats, the time between your beats, is going to be less. So then when you do
so if my heart rate when I'm sleeping is 45 beats a minute,
right?
Okay, and it's pretty regular. Okay, how would stress change that?
So even if your resting heart rate is 45 beats per minute, there are going to be some subtle changes overnight, and a lot of that kind of changes within sleep cycles and things like that. You know, REM sleep, it'll kind of bump around, but in a slow wave sleep, it'll fluctuate a little bit. And essentially, what you do is you measure every beat in that time frame during your slow wave sleep, and then you measure the standard deviation between the beats. And if that standard deviation is low, meaning your heart rate is not able to change much on its own, how it would naturally, that would mean that your body is under a cumulative stress, kind of, that you've put yourself under in the previous day or week or months.
They refer to it as the vagal break. Your vagal tone, the more vagal tone you have, the parasympathetic breaks in and interrupts the sympathetic system. And so if you have a healthy vagal break, then your sympathetic nervous system is constantly being interrupted, which is good.
Did this come from like athletes training and stuff like that? Give me a little historical perspective on this heart rate variability, because when I went to medical school, we didn't talk about heart rate variability as far as I know.
So it's not really that prone in the literature. It's actually currently utilized most in the psych world.
The psychiatric world?
Yep,
or cycling world?
No, well, also cycling, but scientifically and medically speaking, psychiatric world, actually looking at responses to stress and things like that. So from a cardiovascular standpoint, because it's obviously based in cardiovascular physiology, there was a lot of work in the late 90s and early 2000s to use heart rate variability to track disease progression. And they actually showed that for heart failure patients, for example, that when you start them on a beta blocker, that their heart rate variability would change, and that would correlate with their symptoms and with their progression of heart failure. Then it fell out of favor just because there was better ways of measuring things, whether you're looking at EF recovery or, just other symptoms, because heart rate variability just was not, it was just something that you would have to constantly monitor for it to be helpful. And that it's still present on, if you look at Holter monitor reports or CRT devices that folks have, you can still get that metric. But it's not really used clinically as often.
So how did you get interested in this study?
So I started wearing the device in 2017 through doing CrossFit. I used to, I'm in Penn State Hershey in Hershey, Pennsylvania now, but I was in medical school at the University of Rochester, and a couple of my friends at the gym found this new device at the time, and it seemed really interesting. And basically from a fitness and training perspective, you can use it to optimize your training, because it gives you a recovery score, which is a lot of that is based off of your heart rate variability, how much stress that you've put on your body. And there, the way that the device is kind of sells it is that it's based off of your physical strain or stress that you put on your body. And so then you optimize your training, how hard you're going to push based off of how recovered you are. And then it can also measure how much strain you put yourself under during the day, and you try to match your strain to your recovery to optimize training.
So is every sport doing this, like basketball, baseball, tennis?
A lot of sports are actually doing it now, but for a slightly different reason, actually. So because you have every heartbeat over time, you can actually back calculate respiratory sinus arrhythmia. So subtle fluctuations in your heart rate, you can actually determine your respiratory rate. And so when COVID hit, obviously respiratory rate changes was a big thing. And so they actually were working on developing an algorithm, and still are, for early detection of COVID. And people are anecdotally seeing spikes in their respiratory rate with COVID exposure even before symptom onset. So that's one of the other things in the works. But actually, there's a partnership now with the NFL. When they were determining their coming back to safe play, a lot of NFL teams were outfitting their athletes with the Whoop devices to track for early spread or early symptom onset. Nice. So you'll see it on a lot of people. I mean, Patrick Mahomes wears one, and you can use it for training, or you can use it for a boatload of other things, whether it's research, respiratory rate.
I interrupted you earlier. So you started using the device for CrossFit, but then how did you get the idea to do this study? What led to this study?
Yeah, so I was basically training actually for a CrossFit competition down in Miami called Wadapalooza that I competed on as a team last February, right before everything got crazy. And the month before that, I was doing an ICU rotation, and everything was the same from a training perspective. I was just kind of doing everything normally, but I realized that every day I would wake up and my heart rate variability was just low, constantly low, no matter what I tried. If I tried sleeping more, still low. If I tried, hydrating well, doing all kinds of things that I've found work for me to kind of improve my physiologic response or increase my heart rate variability, and everything was still super low. And so I'm sitting there on ICU nights one night. And I was like, maybe it's just because right now I'm super stressed out because, we're taking care of a lot of sick patients. There's a high acuity, I remember specifically.
I remember being a resident, you feel like you're going to kill the patient because they're so sick.
Right. And when you're overnight and you're the only buddy covering the unit, you're the senior resident covering the unit, and you're the primary call for all the codes and all of the ICU admissions for the entire hospital, there's a lot of stress on you. And so what I did was I said, I wonder if we can kind of use these metrics. And so I actually went back and retrospectively plotted all of my rotations and duty hours against the Whoop metrics, like heart rate variability, sleep duration, and resting heart rate. And I saw some really interesting trends, specifically that when I was working a lot, it was associated with lower heart rate variability, higher resting heart rate, and less sleep. But actually, so then I did some regression analysis to control for the duty hours. And I actually found that there were certain rotations that showed a much lower blunted heart rate variability response, signifying an increased stress. And so, this was just N of one and retrospective. But
so what were those rotations? What rotations were your triggers?
So it was the ones that you would think. It was the ICU, and then actually our step down unit, which is a pretty involved rotation because you have patients that are almost ICU level, but there's high turnover, whether they're ICU downgrades or upgrades from the floor. There's constant turnover. They're pretty sick still, but you don't have the ICU level of care with potentially intubating them or putting them on pressors. So you kind of have to keep a lot closer eye on them. So those two were definitely the most stressful. And then on the flip side, you had things like consult services where you're not a primary, you have weekends off, the duty hours are much more relaxed. Those were a lot better. And then clinic as well, in the outpatient setting. Again, weekends off, a little bit more of a relaxed schedule.
So what are your thoughts on that, Rodney? Here he's like, okay, I've got this data, why can't I have better metrics? And then he's figuring it out that it's stress. How do you react to that? What are your thoughts on that, Rodney?
I think it's brilliant. I think your insight was fantastic. And I think that you asked the right question and then you followed through looking at the data. The only thing I would say is obviously there's a pretty direct correlation between sleep and learning, but the eustress and distress, I think that each individual is so unique in their ability to absorb information. Eustress is good, but that same exact person in a new situation will have distress. And so how do you differentiate between eustress and distress?
That's a great question. I think that we might be able to answer that a little bit in our current study, just because we have people of we have a good spread of PGY 1, 2, and 3 residents that have been exposed. Some of them have already been exposed to some of these rotations. Some of them are doing it brand new. And we had a very robust baseline characteristic surveys. So things that we can control for in the final analysis, things like grit, which has actually been shown to correlate in medical training, especially in surgery, where they're thought to be working even more and even higher stressful rotations. To see maybe those folks that have a high on the grit scale are less sensitive to changes. Maybe they don't get affected by going to the ICU or to clinic.
Yeah, like a David Goggins sort of person versus somebody who just wilts under the stress.
Right, exactly.
David Goggins.
Oh my God, yeah, that's a whole other conversation.
It is a whole other conversation.
Well, who is David Goggins?
He is a man who started. I'm sorry to interrupt. Hijack.
No, go ahead.
No. I wanted you to.
This is a great segue, actually, to something else I want to talk about.
Okay, right on. So this guy had a difficult childhood. He joined the Air Force. He was 300 pounds, and he was spraying for bugs in the Air Force. And he just had the idea that he wanted to be more and do more. And so he wanted to become a para swimmer, person in the Air Force. And that's the highest level of the Air Force. It's like the Navy SEALs of the Air Force. So he learned how to swim and he became one. And then he had the idea that he could become a Navy SEAL. And so he went through SEAL training and he became a Navy SEAL. And then he decided he wanted to be a Marine recon, which when you go to recon training, nobody knows who you are. Like there's no medals anymore. No one would ever go from SEAL to recon. So he went and did SEAL training. Recon training. So he's a recon pararescuer and a Navy SEAL. And then he went into Delta and he washed out of Delta Force on his last mission. But he is an amazing athlete, human being, and he is a guru for all of us who endeavor to do athletic things.
But mental toughness for him. Mental toughness. For him, mental toughness, that's the big thing. And basically what he says is you can do anything that you want to do. And, some people stop because of physical limitations or, it hurts or it's sore. But basically what he's like, it's all up here.
Well, when I play tennis, I pack a lunch. Not only do I pack a lunch, I play very competitive, but not only do I pack a lunch, I pack IV fluids. So this way I can just bail myself out if I put myself in a situation, and people who play me know that it's going to be a grind. It's going to be a very, very, very hard match. But I'm curious. So, Rodney, how do you identify people that need intervention, let's say, or need help?
That's something I'm working on, and I think that it's very difficult if you don't know someone to identify someone who is in distress, because a lot of times eustress and distress look very similar, and that's why this is such a fascinating field of exploration that you're doing, utilizing the cortisol in the saliva, utilizing the Whoop information and their sleep data. I think those things can help flag people who are in trouble before they get deep into the weeds. So I think this is research that's very important and will be important in the future.
The thing that I heard that was interesting, Alex, is it seems like, there's like, maybe like residency should be longer, but less intense for some people. And then, because it's really more of, this is being a physician is really ideally meant to be a career for a lifetime, not for 10 years and burnout and done.
Yeah.
So
I think even more important than that is to teach these young people mechanisms to turn distress into eustress. The only difference between distress and eustress is the cognitive framing of the individual that's receiving the information and the stimulus. There's nothing really different between person A and person B, except for how they're internalizing and interpreting and the beliefs that they have in their mind.
Yeah. I don't know. My worst rotation was doing the pediatric neonatal intensive care unit. Because number one, I was not going to be a pediatrician. And number two, I wasn't going to take care of intensive care unit premature babies. And I would be on call, and I was, just out of medical school. I'm the guy in the hospital, and I was just always up at night, scared they were going to call me to intubate a preemie, and they had me practice on a cat for 2 hours, and it was just a very, very scary thing. And so, I don't know. So where are you headed with this, Alex?
Well, interesting point that you make there, because one of the things that we're actually looking at is, what people want to go into eventually. Because I think that that's another thing. And I think we can all attest, if it's not something that you really enjoy doing, it's going to be more difficult for you. Even if it's, kind of maybe some people think it's easier per se or whatnot. But so one of the things we're actually controlling for is basically, like if this is something that you want to do forever or not. Because, if you like the ICU, if you want to do Palm Crit Fellowship, then you're probably not going to see that same physiologic response to stress from working in the ICU because you like it. Same
Right.
thing. Maybe you like the ICU, and you don't like clinic because you don't like the workflow or something like that. So I think to generalize to say, okay, this is an easy rotation, that's all subjective, and everybody's going to be different. And so if we can control for enough variables, I think we can really pinpoint that answer.
So you're a PGY3, is that right?
PGY3, yep.
So you're finishing in 9 months.
Yep.
Right. So what are you going to do next year?
So I'm actually applying for cardiology fellowship currently, and kind of hope to pursue further training in cardiology and pursue these research interests. Actually, one of my passions has always been remote monitoring. So obviously this falls into that category, and I've done a lot of work in remote monitoring and heart failure in particular. And so we are going to be actually doing a WHOOP study in heart failure patients to see and how the heart rate and respiratory rate changes, if that's predictive of hospitalizations for heart failure and things like that, see how it correlates to their NYHA class, because we have preliminary data on implantable devices that measure these same metrics. So, but that's kind of an aside.
Sure.
Yeah. So
when will this study be published, and where do you want to publish it?
This current study, so it runs for this entire year of training. So it started July 1 and it goes to June 30th of 2021. We're going to do an interim analysis of the data at 6 months, which I think we'll see some interesting results. I've already taken a peek at some of the data, which everything is blinded. And
so are you not blinded if you took a peek at the data?
Well, everything is based off of subject numbers, so it's just subject one, and they have heart rate variability of boom, 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 boom. So
what have you learned so far?
What we're seeing is that there's major trends within that heart rate. We're seeing that people's heart rate variability and their sleep are predictive of kind of what rotation that they're on. That's the only way that I've been able to look at it, because I don't have the full data set. But if you look at just, subject 10 and you look at their trends for everything, you can say, ooh, I think that, something was going on here. And I don't know who it is, but it looks like it's cycling on a rotation, like on a 2-week basis, which is how all our rotations are scheduled.
Have you identified any outliers yet, or any super?
So everybody has a different baseline for heart rate variability. So, my average might be 60 and my standard deviation might be 15, whereas someone's average might be 150 and their standard deviation might be 30. So when we analyze that, we're going to do it change from baseline. So it's not just just looking at the magnitude itself. And the really interesting thing is the WHOOP device actually can determine sleep stages, not just sleep duration. The way that it does sleep duration is it can detect changes in heart rate spikes, and then it has an accelerometer. So when you start moving around when you wake up, and based off of your heart rate patterns, it can actually determine which sleep stage you're in. So light sleep, deep sleep, and REM sleep. And this was externally validated in a study published in the Journal of Clinical Sleep Medicine back in February of this year.
How does sleep apnea affect some of the data?
I actually don't know. Just because it hasn't been really looked at that much. So that one I can't answer.
I have sleep apnea, and I've tried a CPAP, and I just could never do it.
It'd be interesting for someone like yourself to, obviously if you can't do it, you can't do it. But if you did it for a month and then you didn't do it for a month, and just to see what your metrics would look like, to see if your sleep would improve.
I would think those patients will be chronically sympathetically activated during the sleep cycle because they're hypoxic and expiring constantly throughout the night.
Mm-hmm.
You would think that would shoot up cortisol, shoot up heart rate, decrease heart rate variability. It seems.
Yeah.
You would think that they have a bunch of people and data on folks that have sleep apnea. They don't use a device.
Correct.
No one can tolerate that device.
Is that what you want?
What? I would love.
That's my hypnotist speaking to you. Is that what you have to embrace it if you want?
I did try to embrace it.
I could work on that for you.
I got rid of it. I mean, I really tried hard.
We could make you love it.
So I wanted to say one thing along the lines of the Goggins conversation was when quarantine hit and everything got crazy. And we talked a little about CrossFit before. But one of my friends wanted to start practicing for Murph, which is typically done in Memorial Day. And it's a 1 mile run, 100 pull-ups, 200 push-ups, 300 air squats, and then another mile run, all with a 20-pound vest. And so typically done Memorial Day, kind of nationwide, worldwide. Mike Murphy was the soldier that it was based upon. Actually, he was Taylor Kish played him in Lone Survivor with Mark Wahlberg. And so it's a pretty famous workout. And I don't really know how this all happened, but it was like March and quarantine was hitting. And so I decided to see if I could do Murph every day in a row for 30 days.
What? No.
And so I did that. I finished April 17th. So I actually, because of having the Whoop, I was so in tune with all my physiology. I would look at everything every night, to see the spikes in the heart rate, where I was kind of dipping down in the workout. And I would do it a bunch of different ways. I would do it unpartitioned, so all the way through, and then I would do it 20 rounds, and then I would do it
with no recovery ever.
Yeah. So the interesting thing is I never looked at the lag time between workouts. So that's one of the things that I actually have to go back and look at, because I have all the data. And I actually wrote an article about this, and how I use the tracking of this with the Whoop device to essentially optimize everything so I could do it. And I actually, in 30 days, I increased my average heart rate variability and lowered my resting heart rate. I think I was like 1.5 standard deviations off of my baseline, from like 3 years worth of data. So quite substantial amount.
Because you're an athletic stud. Not many people in the whole population could do that.
Yeah, next time, no jacket, no tie, no shirt. Yeah. Next Doc Talk Live we do.
Oh, well, I
had clothes from the waist up.
I wore my favorite tie, my Bills tie. So I'm from Buffalo. Bills are 2-0. So I had to give it the plug. Josh Allen leads the league in passing. Stephon Diggs leads the league in wide receiving. So those are my boys.
So I was talking about Goggins and stuff. Are you familiar with box breathing, the Navy SEALs box breathing?
No, I'm actually not.
So one of the things that I'm passionate about is living parasympathetically, like constantly parasympathetic activity, meditation, yoga, breathing exercises. And we know that those things increase your heart rate variability. And there's even apps and stuff that you can use with some of these devices to do 10 minutes of breathing a day that helps increase your heart rate variability. But the Navy SEALs have box breathing, where you breathe in for a 4 count, hold for a 4 count, out for a 4 count, hold for a 4 count, in for a 4 count, hold for a 4 count, out for a 4 count, hold for a 4 count. And just doing that stretches the vagus nerve. It's just called vagal breathing. And you can find tons of research about just training people to do the box breath And 5 minutes of box breathing significantly increases your HRV. It stimulates your vagus nerve. It accesses your inner pharmacy, releases serotonin, dopamine, endogenous opioids, cannabinoids.
So could you take the stressful rotations,
right,
and have the resident do box breathing like during the rotation and see if that changes their metrics?
That's your second study.
That's, well, I mean, but you hit the nail right on the head. This is all interesting stuff, and it's all, I think that we're asking the right questions. The if someone's playing devil's advocate, you say, okay, this is great. What do you do with this? And
we lost you for a second.
Oh, am I back now?
Yeah, you're back.
I think you hit the nail on the head, because this is all great stuff, but the question is, okay, what do you do with it?
Yeah, right.
And I think that's, you need actionable items, things that you can do to mitigate this negative response, essentially, that increases burnout, increases depression, and things like that.
I think the bigger picture is we need to think of everybody needs to think of themselves as an athlete.
Yeah.
And what you're doing is you're taking athletic principles that athletes use in order to improve their function, their ability to do a sport.
Yep. And
then you're now applying this to your colleagues who are just trying to get through the workday and have a positive experience. You follow me? Be the best doctor they can be the best nurse anesthetist they can be. And it's about time we start taking some of this science and, not just letting athletes use it, but taking a page out of their book and saying, hey, we are all athletes. Some of us are just less conditioned than others.
Yeah. Or conditioned differently. I mean, an athlete can't do a 72-hour trauma shift on a weekend and stuff like that and still stay like mentally in the game.
That's the key. I love the box breathing technique because they actually use it when they're under fire. And in combat situations, they train it to steady your aim, to help you think rationally, logically, and clearly. And those are all things that we need to bring to the OR or to the ICU, because we're under, it's almost the same. If you measure the stress that we're under, it's almost like being in a live fire situation. I could imagine, even though I've not been in a live fire situation, it's life and death.
Right.
It's just somebody else's life.
Right. Exactly.
Right.
And really the comparison that I make is that I think that medical training is the most difficult training regimen of any career path that doesn't have a physical fitness requirement, like the military, for example. But, we're under extreme amount of stress, and whether that's, physical or mental, emotional, really you have to find ways to optimize it. And I think that's the whole thing with the past few years, this wellness initiative that people put into place. I feel like people are missing the ball on it. You get lectures on wellness, you get, modules to do. I remember one of my friends in residency out in Colorado was posting, posted a screenshot of an email, like, please fill out your wellness module by the due date. Like, this is your second reminder. And it's like, just receiving that would burn me out.
Just another action item, just another thing to do.
Yeah.
You guys talk. I want to see if there's any questions I'm going to log into my Facebook on the phone, because on Zoom, I can't seem to see if there's comments or questions at the same time.
Have you seen the ring that people are wearing now?
The Aura ring.
Yeah. That's pretty cool.
It also measures the heart rate variability. I don't have nearly as much exposure to that one. I haven't actually seen it in person or whatnot. I've heard good things, and I've seen some screenshots. It looks.
Yeah, they're the ones I was reading about, using their proprietary algorithms to find out about COVID.
Yep. The NBA kind of hopped on with them, and then NFL went with Whoop.
Right on.
It was kind of there. And I think maybe I have a bias just because I've used it for training. That's what I know.
I love the data that the Whoop provided. It just, like I said, it just competed with this. I can't wear like things all the way up my arms or pull chest strap.
They do have a bicep band now.
Oh, nice. Okay.
So I mean, you know, you could do it. I mean, I got the Apple Watch and I got.
Oh yeah.
I'm double strapped there. Some people wear both on one arm.
I'm hoping they'll get eaten up by Apple, and Apple will adopt the technology, and then ultimately I'll just go to that, or Garmin.
I mean, yeah, it's so interesting. I actually did see one person that had they had a watch, and they took the their watch face off their band, and they wore it on the back of the Whoop, and they threaded it in here, and so it was like the watch face was here, and then the Whoop was here.
Yeah,
I mean,
I would love that.
I sleep with it like that. So, but yeah, I mean, I'm fascinated by the device, everything that it gives you, because it really gives you the option to do things.
Yeah.
And it actually, one of the newer features is the Whoop Journal, which allows you to click on and off your lifestyle activities or behaviors.
Yeah.
And then it basically gives you data analysis on how that affected your recovery or your sleep and whatnot. It's all basically just a unpaired t-test of saying yes, no, that I did this.
Think how much fun you're going to have in your career when you start using Neuralink, whenever Musk gets that figured out and you start getting all that data.
You know, I think one of the things moving forward is there's so many things that we can track. Now it's like, okay, narrow it down to like, what are the most important things?
Yeah, the actionable items. Yeah, I agree.
And then really developing these, you know, these algorithms that can take into account multiple parameters to give you like a distilled number, or, you know, kind of say like, this person is at risk according to our data for, you know, having like burnout or depression or something like that. Like, you know, maybe then it's like, okay, what do you do? Oh, you know, maybe can meet up with them, see how things are going, make some of these suggestions and see how that improves it. And you have the way to monitor their response physiologically and subjectively if you want to do surveys or whatnot.
So Alex, what are some suggestions if somebody's watching this? And I hate that I put this at the end because, you know, very few people will watch this to the end unless they're really interested in this. But what are some suggestions as far as just, because I didn't know what a Whoop was. I didn't know what heart rate variability is. I don't know any of this stuff, but you know, I'm interested in health and being healthy and wellness. What are some suggestions, some takeaways for me and other folks if I were to get a Whoop device or a cheaper one, or what are your thoughts here?
I think that it can be used for whatever you want to do. If you want to say, I want to sleep more, you know, it's gonna tell you when you're sleeping, when you're falling asleep, the quality of your sleep in terms of, you know, how much of it is restorative. And then you can change your behaviors to try to adjust that to improve your sleep. If you want to use it for fitness and for training, you can tailor your training around optimizing, you know, how hard you push in the gym versus how recovered you are. You can also, you know, use it to just generally track, you know, some of your lifestyle behaviors and say, oh, every time I drink alcohol, like my heart rate variability is extremely low. Maybe I'll stay away from that a little bit more, or maybe I'll do that in moderation, like I know I should, but maybe I don't. But now you have that objective feedback to say, well, I know I felt like crap, but like now this is also telling me that my resting heart rate was in the 80s when I drink. Maybe it's not as good, and maybe I will make some changes there. So I think that, you know, it's almost the world is your oyster type of thing, where you have all this information and you can do basically whatever you want with it, which I think is the exciting part.
I guess what I need is a buddy who really gets into the data and can dissect it. and then I wear this thing and then we look at it together and he says, okay.
There will be an AI before long, a robust AI that each company owns, and that will be your buddy. And
that's awesome.
I think giving the CPAP another trial with and without it would be a really interesting way to do it.
Well, see, I don't even want to pay for the darn CPAP again. It's like $400 or $500, and believe me, I tried. And the reason I went to the CPAP is I wanted to improve my tennis, and so I felt like if I was improving my sleep,
I agree with it. Wear the Whoop and see.
Well, here's the alternative. You get the Whoop, and it'll tell you, you can look at how much deep and REM sleep you have, and you can make adjustments, whether it's like hydrating more or not eating late meals, or eating, if you do eat a late meal, you can eat more of a casein-based protein that's easily digestible, things like that are going to help with your sleep, help with your recovery, help with your heart rate variability. And I think that would probably improve your tennis. And so just right there, without kind of going the.
What would improve my tennis is if I would stop being so nervous on the court and being afraid to miss.
I know
that might be the breathing.
Exactly. I need a good hypnotist.
That's the box breathing, I think.
Yes.
Truly.
Yes.
I totally agree with that.
If you
did you see the U.S. Open? That was the best, worst tennis I've ever seen. These guys are at the highest level, and you're telling me that Zverev, who's 6'6", who has a 140-mile-an-hour serve, couldn't serve over 80 miles an hour in a second serve. He was so tight. It's unbelievable.
Yeah. Those
guys were choking more than I've ever seen.
Yeah.
It all becomes mental.
Yeah.
Eustress versus distress.
Yeah.
All right, I'm going to leave it there. I got to go to work. I got to do some real work.
Fair enough.
Alex, I got to get you guys to come back and keep sharing stuff, okay?
Yes, sir. I would love to. This was a great chat.
Pleasure to meet you.
Yep.
Thank you, guys.
All right.
Appreciate it.
Have a good one.
Bye. I'm going to stop the